if you are somebody who has heart disease, it would behoove you to make sure that loved ones and people that you spend a lot of time with are aware of the newest protocol by the American Heart Association, which is called two-handed compressions only CPR. It literally is an education. You can watch a 2-minute video to learn this. You alert 911 should you go down and you can't help yourself. Make sure the people around you know hands-only CPR, which is the newest technique by the American Heart Association. I'm putting a link below. It's a 2-minute video for you to watch, and basically it's alert 911 to make sure that their EMS is on their way, and then go over your body and just do compressions. It tells you the speed. The video I'm referring to tells you what speed and gives you some criteria on how to do it, because that might be the thing that saves your life when you are not able to, should you go into cardiac arrest. Hi, welcome to the Judy Terrell Show, where I explore topics intended to optimize every body 50, 60, 70, and above. Heart disease. It is the #1 killer of both men and women globally on the planet right now. And are you somebody who maybe went to your doctor recently and was told that your cholesterol levels were high or your triglycerides were high? Are you somebody who has a family history of heart disease and now you're in an age range where you're starting to feel like you're even more at risk even though you don't have symptoms, and you want to make some lifestyle changes that are going to help you to avoid heart disease and the manifestations of it? Then you are in the right place on this video. I am a PhD candidate for lifestyle medicine. I have been in the fitness and wellness and nutrition industry and health, coaching industry for 43 years. I'm 62 years old myself, and I work in the trenches day in and day out to help clients who come to me because they want to do the lifestyle interventions and try to put off and avoid the medications, or they're on the medications, but they don't want to keep getting deeper into that because they have come to know, and I'm going to tell you right now, that heart disease, 80%, that's the statistic that is out right now, is avoidable, arrestable for symptoms, and you can turn it around and reverse heart disease by your current lifestyle habits and patterns. All right? Many people think genetics is destiny, but our epigenetics studies now show that that is not the case, that you can do things, behaviors and practices and environmental, influences that can actually not have genetics manifest. It can block the expression of those genes, all right? So that's good news. So even if you have heart disease in your family, you might be more at risk of it, but what you do every day can actually keep it at bay. And like I said, arrest the development of it if it's already manifested, or reverse it. And so that's what I want you to get from this video. And I'm going to cover some things in here in a quick, succinct way, hopefully, because nobody has patience anymore. I want to cover a couple things that are not typically known or understood, or are coming out to the surface, like the information that everyone is getting. Everyone knows, eat a certain diet. Everyone knows you need to exercise. But within there's some nuances, and there's some other things that I want you to know in this video before I'm done. And so let's jump right into this, all right? So there are definitely lifestyle practices that you can do to prevent, arrest, and reverse heart disease. And the first thing, the first strike that everyone makes is their eating plan. All right. So the two type eating plans that are most correlated with preventing and reversing heart disease is the Mediterranean diet and a plant strong, lean protein strong, whole food approach diet. And I am an advocate of both of those. But the reason why eating plans are not, advocated across the board is because we are all bio-individual, and how certain things react in one person's body, the right balance of certain macronutrients, protein to carbs, and the type of carbs, there's a lot of individual difference. And so you really want to work with someone to help you to discover what's going to be best for your, heart disease prevention program. But in general, whole foods and a good mix of, plants that are fruits, vegetables, whole grains, nuts, seeds, are the type of plan, and then depending on who you're talking, who you're getting information from, the inclusion of protein sources can vary. But everybody agrees whole food eating would be what somebody with heart disease needs to be paying attention to. But here's the nuance, all right? What a lot of heart disease clients that I work with are being told is that they really need to cut out the saturated fat, and I am in agreement with that 100%. But what they're not being told is that the sugar consumption, added sugars, high sugar content, and flour-based foods, and they're then combined with fats in a meal or in a food item, the high sugar can actually make the blood very sticky, highly inflammatory, but very sticky and viscous, and that can contribute to plaque buildup in the arteries. All right. So I have a lot of clients that have been very successful at cutting out fats, and their cholesterol levels are still high, and they go get imaging, and they're found to have a certain percentage of arteriosclerosis, or they have high calcium scores, because calcium and that hardening of the arteries will get into the lining of the arteries when there's a high amount of sugar, making that blood sticky and viscous. All right. So if you take nothing from this video, you want to add to your heart healthy eating when you're thinking about what to do, this piece about really watching the added sugars and the high sugar flour product foods that you are eating, because that is a big contributor. Everyone thinks about that with diabetes, but it is a significant contributor to higher cholesterol levels because of how the liver has to then deal with that sugar, and then the sticky blood and the arteriosclerosis. I have helped clients reverse their cholesterol numbers by 40 points within 4 months by focusing in on the sugars even more than the fats that they're eating. So that's a critical nuance that I see in my practice. That is one of the reasons why I want to put this video out, so I can highlight things that are not necessarily getting the kind of attention that I think they need. All right. Along with consumption, everybody knows, if you have heart disease or at high risk of heart disease, or you're trying to manage heart disease, you got to cut out the alcohol. Like in 2024, meta study came out actually tipping the recommendations over. It used to be it was recommended 2 drinks a day for men and 1 drink a day for women was considered healthy. That has now been debunked. Not 1 drop of alcohol is considered healthy in the human body. And if you are battling or trying to minimize your risk of heart disease because you have the genetic predisposition, then you are somebody who just has to find alternatives to the alcohol. It's as simple as that. Your life is dependent on it. There's other things you can do for entertainment. And along those same lines, smoking. I think everybody pretty much is clear. Smoking is bad. I think the percentage of people that are smoking is definitely way down. But what is it like? So smoking, people, I have clients that come in and they're like, well, I don't smoke. But what I'm noticing with my clients is vaping, younger clients that are at risk of heart disease, because everybody is, if you've got a genetic predisposition. So vaping is a way of smoking that is kind of under the radar, that is not getting correlated with heart disease to the same degree. And then the other thing that's happening right now, because marijuana is now legalized, in many, many, many states and around the world. So if you're going to take in THC as medicinal purposes or stress management purposes, just be mindful that you don't want to smoke it. Take it in an edible, take it in a gummy, another alternative way of getting it in than smoking it, because that is, the smoke piece is correlated with higher risk of heart disease and manifestation of it if you're, genetically predisposed. All right. So those are important points for you to take into consideration from the consumption point of view. All right. Now let's talk about exercise. Again, everybody knows exercise is good for your heart, but I work with a lot of clients that are over 50 and women postmenopausal, and there's a huge push now for throw out your cardio, just lift heavy because of sarcopenia, which is the lowering of muscle tissue on the body, and how important that is for longevity and health and hormonal management, symptoms of postmenopause, osteoporosis, a whole host of things. But what I am seeing when it comes to heart disease management and other things is you do not want to throw the baby out with the bathwater. Yes, you need to do strength training, and muscle is the organ of longevity. I'm in agreement with that. But I'm watching my clients throw away their cardio and the cardiovascular exercise of pushing the blood through the arteries at a higher level, so that if anything's thinking about, kind of embedding on the walls, you've got a regular practice of stopping that from happening. It's like a high-powered hose in your arteries on a regular basis when you are doing cardiovascular exercise. And it doesn't have to be high end. Even if you go for a brisk walk, or you swim, or you dance, or you ride a bike, but you're not, sprinting up hills, there's that high intensity exercise. I'm going to talk about that in a second. But I'm talking about moderate levels where you're breathing deeper than I am right now, but you're not breathless, but you're sustaining it for, 10, 20, 30 minutes or more, but in a more of a stress management kind of point of view. So when you come back from your walk, you feel like you sweat and you feel like you got a good workout, but you're not depleted and you never got breathless per se. This is more of a zone 2, 3, which is now getting, if you talk zones, if you're into that, you've been made aware of that. Zone 2 and 3 now are like, Satan, when it comes to, weight loss and cortisol spilling and all things that you're reading and hearing about. But when it comes to heart health, you will be disserved if you are thinking that that is a bad thing. It is a very good thing for heart disease management. It also strengthens the heart muscle, keeps that nice and strong to circulate that blood around. So for all these reasons and more, do not throw your cardio out if you are trying to manage heart disease or trying to prevent it or trying to reverse it. When you have tried all the programs and done all the right things, and yet you still can't lose the weight that you're trying to lose, and you're a male or female over 50, now is the time for you to look into my program, Your Second 50.life. It includes online video support. You can download video and PDFs for eating plan and exercise plan appropriate for over 50. It includes group support on a monthly basis, and perhaps even more importantly, it includes weekly individualized coaching specific to you. Having the generalized plan is a good thing. I have helped literally thousands of people to lose weight over the 43 years I've been in practice, and I'd like to help you too. Now, the high-intensity intervals where you're going as hard as you can and getting breathless, there is a place for that as well in heart disease prevention, but you only want to do that like maybe 4 times 20 to 30 seconds each, 4 times in a row, catching your breath in between, and you'd want to do that once a week, maximally twice a week. So a lot of people are doing like these Peloton workouts or HIIT interval training, and I'm not saying that's not good for us. I'm just saying if you have heart disease, that can be stressful and create adverse conditions if you do it too much. And if you're being told to, throw out the other levels, level 1, 2, and 3 zones, cardio. So the nuance here is, yes, you want to do that cardio, and yes, you want to do the interval training, but be careful the ratio. Don't throw out the lower end realms, the lower intensities, and then just do these high intensity ones. That might be good for some other things, but when it comes to heart disease management and honestly, mitochondrial function and stress management, you want to keep these moderate level cardio kind of, practices in your life to reverse heart disease. Very important. So I want to make sure that nuance is covered in this video. Okay. And now a third piece that I think is being, not highlighted, that's really important. Everybody with heart disease is being told you need to stress manage, okay? But there's a couple of nuances within this that is getting lost in the shuffle. So research shows when it comes to like a body-mind, like kind of the link of that, there are certain like mental and emotional personality variables that are more correlated with people that manifest heart disease than people who don't, okay? And so feeling time constraint and feeling like hyper vigilant that the world is kind of a dangerous place that's kind of out to get you, or adverse if not dangerous, and then being hyper vigilant to that. Okay? So these two nuances. So like always feeling like there's not enough time, and then feeling as if like it's you versus the world. All right? Those two personality or personality characteristics are more highly correlated with people who are who manifest heart disease over people who manifest, let's say, diabetes or migraine headaches. There's a whole science on mind-body connection and personality, emotional kind of profiles that go with certain diseases. And this one I'm talking about right now is important for people who are trying to prevent, reverse, or, slow down the progression of heart disease. If you are a person who identifies with one of those two characteristics I just talked about, then yeah, meditation is really good for you, and taking yoga and, breathing techniques, all those things are really good for stress management in your heart healthy program. But the nuance here I want to get across is you also have to do some work on, sculpting out time so that you're not always feeling time crunched, all right? How you're programming your day, how you're scheduling your day, building in 10, 15-minute blocks or breaks, taking a day off earlier on certain days, like once or twice a month. There's a lot of different ways that I will help an individual client I'm working with to address this, task management, like, not thinking that you have to handle it all, but, appropriating things out to other people so that you don't feel like you have so much on your plate. Like, again, I'm just throwing out a couple examples here, but each individual that I work with who is trying to work on, minimizing their risk of heart disease or reversing the heart disease they already have, there's a different set of skills. But we are addressing always this like time, not having enough time, that kind of stress manifestation, that personality characteristic. Some people are easy breezy, they just go with the flow. Some people are just like they don't have lifestyles that have this component, but a lot of people who have heart disease do, and we need specific tools for addressing that. And then the other piece is, your worldview, your life view. You really do have to work on, things that are like, and I'm going to throw out a couple examples, like affirmations or checking your own, self-talk when you say to yourself, I'm always up against, barriers, or nobody supports me, or it's easier for me to just take care of everything myself because if someone else does it, they're not going to do it as well. Like, these are all like manifestations of this second little, like, this personality profile that goes with heart disease about the world being an aggressive, averse place. And you really have to, get your fingers working with somebody on what are some things you can do with your own self-talk. Maybe it's therapy, maybe it's coaching, but you need to be building in some things that are going to help you to counter that, because this time, time crunched, and then the world is a, challenging, aggressive, adverse place. Those two personality characteristics are highly, highly correlated with heart disease. And you can be doing all the right diet things, and you can be doing all the right exercise things. And if you're not addressing these specific personality variables, you are at high risk, okay? And this is why I think, to this point, you'll read stories or people that are like, this person, they went into cardiac arrest and they died, but they're a fit guy or a girl, they were eating right. Like, how could this happen to them? Oh, it must be genetics. I think this psychological emotional piece is a big piece, and it's not getting the proper address in heart disease management and prevention and reversal. So again, I want to cover some nuances in this video that you might not be aware of that I am seeing in my clients when I work with them. And I do think it's really important, if you are trying to reverse or deal with heart disease, that you do find somebody. And I work with people all over the world, because we can do this remotely, to identify some of these risk profiles in your everyday habits, and then how to individualize, like, what are some things that you need to do from a behavioral habit pattern change, both on what your physical practices are, but also what your emotional and mental and psychological practices are, because you need to address like a matrix of things in order to have a successful effect at reversing heart disease. And I want to cover the last couple of things here, and things that everyone knows. You need to get adequate sleep, because that's when we are rejuvenating and repairing and, stress managing in our brains. So, getting adequate sleep, 7 to 9 hours, but also getting good stages of sleep. I wear an Aura ring to try and get a good feel and a visual identification. I don't get enough sleep personally, and I don't get enough deep sleep. And so knowing that, and then knowing how you can, try to make some behavioral changes to get better stages of sleep will be very instrumental in your heart health program. Going back to the dietary components, making sure you're cutting out the high saturated and trans fats, but then also getting in a good amount of omega-3 fatty acids. Those are correlated with lower levels of heart disease. So that's an important piece, again, that is not as highlighted as eat good fruits and vegetables. So I want to bring that piece out for you. And another piece when it comes to the consumption is the sodium content of our foods. In my one-on-one work with people, and I'm constantly looking at labels and things and making suggestions for people, the sodium content in so many foods that you're not even aware of, honestly, unless you're really looking at it, is so high. And sodium content is going to be, that's where people are being made to pay attention to when they're battling, high blood pressure and a variety of other things. But when it comes to heart disease, that high sodium content is also a factor. And so I want to make you aware of that. Watch your sodium content. 1,500 milligrams a day, about 300 to 500 milligrams per meal. Look at your condiments, look at your food products. It's not just the salt you're putting on. It's flavor enhancers and preservatives that are being used in our food, and they are perpetuating heart disease and stroke and high blood pressure, which are kind of all in similar category. But as from a heart disease point of view, you really want to be looking at those labels for the sodium content. All right, so that's an important point as well. All right, so these were things I want to highlight that are not typically highlighted. I hope that you took some, aha moments from this video. If you're looking to work with somebody, to help you with your everyday, individualized patterns. I am a personal trainer. I am a certified nutritionist. I am a nationally board certified health coach. I have a master's degree in psychology, and I am now finishing up a PhD in lifestyle medicine to have a doctorate in how to help people to make, identify the lifestyle pattern habits that that are contributing to what they're trying to reverse, and then specific individualizing approaches for how you can make changes in your day-to-day life. All right, everybody, I appreciate you coming to this video. I hope you've listened to the end, and please comment if you took some things that were something that you didn't know. I would love to hear from that in the comments. Look me up if you're looking for somebody to work with, and in the meantime, let's take care of our hearts. And if you'd like to have access to some of my additional resources, I can be found at Facebook, Instagram, YouTube, and on my website, www.judyterrell.com.